Morning, folks. I'm still seeing some folks getting signed on, so we're gonna give ourselves just another minute or so. We do have a lot to cover, so we will be getting starting soon, but I just want to make sure we've only got about 28 people on the call so far. We're just gonna give it just another 60 seconds or so. Okay, good morning, folks. Let's go ahead and get started. This is Matt Haynes, the Special Finance Projects Manager with the Department of Healthcare Policy and Financing. I'm here with Richard Clark from the Office of Community Living, as well as our team from Public Consulting Group. We want to make sure that everyone is aware of the changes upcoming for the 2024 application that you'll be submitting. It actually opens in December of 2023 and the deadline's there in February of 2024. This is going to be part of a continuing theme for us. We're going to make a commitment that going forward, as we unroll a new application, so it's kind of an interesting dynamic with this program, right? So we actually are completing an application through February, but that's also 2 months into the next performance period. And generally, we put the next application out, like this 2024 application hit in March. So what we're going to try to do going forward in subsequent years is when we roll that new application out, that we'll hold this training so that everyone understands what's new in the application that they're in the performance year for, that they'll be submitting as they get to the end of the year. I know we're in August now, so a little late to the game on this first year, but we wanted to make sure that everyone was still aware halfway through the year what has changed for the next application from what you just completed back in December through February. So really our focus here is focused on just the 2024 application and what's new, different, changed, improved, clarified within the application. We'll also hit this again. We do this every year in December when we have the training around how to use the data collection tool. We go over the changes there too, but obviously your performance year is almost over by the time we had that training. So that's really just getting you ready for the application period. So what we want to do, starting here this year today, and again in subsequent years, we'll be doing it more like in March, will be training on just what the changes are within the application. So thank you for joining us this morning and afternoon. See if I can go to the next slide. So we've got a lot on the agenda, but it's we kind of really detailed this out so you kind of know what's contained within our training here today. We're gonna have a few updates here to kick us off, so you kind of understand some changes around the Pay for Performance program. Really good changes to be aware of, particularly if you have any homes that have not applied for P4P in the past for various reasons. Maybe a new incentive to rethink that now. We'll talk about that in just a few minutes, but it is an increase in reimbursement for Pay for Performance. Then we're going to dive into what has changed in the 2024 application. We really want to break this out into 3 areas of priority. And we start with first, are there any new measures, something that was never in the application before and is now new into the program? Are there measures that have been deleted that we've had in the program that are now no? Oh, goodness. So how long was I muted on that, folks? Was that all of
Just
it?
1 or 2 seconds, Matt.
Okay, I think that just kind of happened automatically. I apologize, folks. So I'll kind of rewind. After the reimbursement pieces, we'll go into the application changes, communication, the training. And again, we have it in kind of areas of importance to recognize. Are there any new or deleted measures? So Is there a measure that's never been in the program before? Now there is. Or is there a measure that's been in the program that's now going to be out of the program? So you need to be aware of that. Then kind of the next level will be within the measures that are in the program, are there any new minimum requirements? So something else that's required around a measure that wasn't required in the last year. So you need to be aware of that so that you're not missing that. The third area we'll go over are any places where there's just updates to measures. So there's no new minimum requirements. It's not a new measure, but we have made updates within the language of the minimum requirements or clarifications within the measure. Or updated certain data points that are specific to the particular year of the application. And then we'll wrap it up with the changes piece around, are there any new tools or resources that folks can be able to rely upon for, either you're required to complete or resources to kind of help you through the application? We'll go over that as well. And then we'll close out our training today with just kind of what are the key dates for the 2024 application to keep in mind as we move through the rest of this year, application period, scoring, etc. And John, are you looking for the link to the meeting to be able to forward to folks?
Yeah, I'm driving and nobody was prepared, so they need me to send it, and a copy and paste would be amazing.
Yeah, sure. We'll drop that in the chat right now, John.
Thank you kindly.
Thanks, team. Okay, let's get started. In terms of department updates, so, and Richard, I'll give you a moment to step in here as well. So there is an update on pay for performance payments. That is in House Bill 23-1228. Within that legislation, it has authorized an increase of pay for performance payments based on a percentage of total provider fee payments. Our early estimates are that this will roughly double the total dollars paid. So if we look at how many dollars we paid out in P4P in the last few years, by taking the percentage of total provider fee payments within the legislation, it'll result in an amount that's about double in terms of the total dollars there. Now, how that's actually going to look is going to be interesting, because in the past it's $1, $2, $3, or $4 per Medicaid day, and it kind of depends on who scores where, right? In terms of what the total payments are for the particular hospital, but that was fixed, the $1, $2, $3, and $4, depending on where you scored, 20 to 40, 40 to 60, 60 to 80, 80 to 100. Now it's going to be a little more dynamic. So now it's like, what is the total calculation of the supplemental payments within the provider fee program? Then there's a percentage that's calculated, and Richard, you may have that percentage off the top of your head, or maybe it's one to be determined. And once we know that, then we're going to calculate kind of what the bucket will be. And we want to continue with kind of the similar theme of, you get more depending on the better you score. So it's kind of like 20 to 40 is still some value, which is, I'll just say X. And 40 to 60 might be then 2X, and then 3X, and then 4X. So you'll still have that factor of 1, 2, 3, 4. We haven't finalized all this, but kind of the concept to understand that. But we don't know what X is until we know how everyone scored, what's the total bucket of dollars, and once it is, we kind of solve for that, if that makes sense to folks. Richard, anything else you would add? Do we know around specific percentages and things at this point?
Right. We looked at last year, we paid out about 6.5% of the provider fee on the $1, $2, $3, $4 table. The bill requires us to increase the total dollars up to 12%. So that's where we're getting that roughly double. So assuming that we had the exact same participation and the exact same, number of people falling into each slot, you could probably roughly say that those are just a hair under double. The $1 would become somewhere in that $1.80 to $1.90 range, and all the way up. If we have more participation, that number will trickle down a little bit on a per facility, but we're not going to be able to give a specific number, unfortunately, till we see what the total participation is. In future years, the bill also has us increase that percentage even further. So in 2026, it would be increasing up to 15%. We are anticipating that there'll be more participation now. There's more dollars attached to it. So that will kind of force us to keep track or keep in line with making sure that the program is valuable to everyone participating. And then we can reassess from there. If we feel like that needs to continue to move up in future years, we will then have the discretion after 2026. So I think putting this all into context of what's going on here, this is the first time we've had an increase, I think, since the program started. The increase is going to be significant. The way that this is now attached to a percentage of provider fees, we can expect that will grow over time. As provider fees increase naturally, that means the program will continue to increase naturally. It won't be a stagnant dollar that's not keeping up with inflation anymore. So if this is your first year doing it, it's the best year to start, probably in the last 15. And if you're just trying to chime in, you can start to figure out what type of things you can add to move your facility from whatever tier they're in up a tier. It's the best year to start implementing that. So part of why we're getting this training out earlier is so that everyone can have the opportunity to score as high as they can and earn those extra dollars now that there's some better funding attached to the program.
Yeah, that's great. Thanks, Richard. And if I recall, I mean, the provider fee total supplemental payments, to what Richard was kind of referencing there, are about $100 million, I think, right now. So we were paying about $6.5 million to pay for performance. So another $6 million, $5.5 million kind of going into the program if we're looking at 12% of $100 million. And then to go to 15, it'd be $15 million. So really a lot more financial incentive we already know that there's a huge value in this program. Folks look at this nationally. It really builds a nice culture of quality and being able to highlight the good work that you're doing and being intentional around it. But now we get to back it up with some more incentive capital to help reward you for all the good work you're doing. See if there was any questions there from folks. Okay. Yeah, we are excited about this, really showing that our shift to one, recognizing the importance of this program, but then the shift from the department to really focusing our reimbursement around quality care. Really, really excited to be able to have more robust funding for this program. So what's changing other than the payment for 2024? We're going to start with new or deleted measures. Good news for you all. I mean, well, I don't want to put value statements, but there are no new measures. We're not adding anything new into the program for 2024. So all the measures that you've seen are still the same measures, except for we are deleting one. And that is the quality of life domain. So that's measure 9 with QAPI. So years ago, QAPI was coming down the pike, and we wanted to make sure Colorado was ahead of the game. So we put this into the Pay for Performance program to incentivize you all to get ahead of the game, and we've proven that. Everyone's been well prepared for when this came down from CMS, but now it's federal requirement and standard practice within the industry. So not the best use of our incentive capital any longer, since it's well incentivized in other places or mandated. And so we are retiring that measure. So as a result, when you see the numbering, this might be important to you depending on how you track things internally within your organization. All of the 2024 measures after measure 8, so this was measure 9, it's been deleted. So now all the measures have kind of shifted forward in numbering by 1. And I'll show you what that looks like here in just a second. So here's kind of a breakdown of the measures. You can see all the way through measure 8, we're still the same, physical environment. And then once I get to 9, it used to be QAPI, and then 10 was consistent assignments. Well, now consistent assignments is 9, volunteer programs 10, staff engagements 11, transitions to care is 12, so on and so forth throughout the remainder of the application. Do want to highlight, you see some asterisks in here as you see this when we send these slides out, that these are places where there's been just some changes around some of the point systems, and we'll talk about that as well. So what has changed in terms of minimum requirements? Have we added any new minimum requirements? We have. So under the measure 13, equity, that has now been broken up into two subsections. One, initiatives, and the second is accessibility. So measure 13.1.1 through 13.1.3 is under your initiatives. That is now worth 4 points. And then measure 13.2.1 and 13.2.2 is under accessibility. That is now worth 2 points. So essentially, we started this measure as we've done in the past. When we start a new measure, we put low kind of points on it, make it more of a lower risk for folks working on new things. But this is a major effort from the department. So now we've kind of ramped up the points here. We've also ramped up a little bit more what we're asking for you. So we want to make sure we're giving you more points for that work. So 4 points have been added to this measure, and again, making it worth a total of combined points of 6. So what is in there now? So measure 13.1. Now we're asking for you to submit your home's written public-facing statement from leadership that supports and prioritizes the implementation and/or administration of a program improving health disparities by ensuring equitable care is provided to all patients. We also want you to submit the location of your home's public-facing statement. Is it on your website? Is it posted at the front desk? Is it posted throughout the home? We always have kind of get an idea, an environmental scan of how folks are communicating this to their residents and families and staff around their commitment. So that's a new piece in there in terms of a new minimum requirement. The other pieces are a little bit similar to what you've seen in the past. We just want to see it. Now, what are you doing? What are you training on in your home around equity? We're going to actually have some radio buttons in the next application, which is going to be nice. So you can kind of select the area or areas that you have done training. So if you've done an implicit bias training and a racial and ethnic disparities training, you can select both of those radio buttons. It'll give us nice discrete data in our data sets to be able to see what's happening around the state. And then you'll have a narrative box that's going to describe what it is. Kind of simplify that for you a little bit too. And then under 13.1.3, we do want, in addition to what training have you done, what are the initiatives? Now, we asked you the initiatives last year as well. So the piece that's kind of new in here is not only do we want to know what the initiatives are, because they're probably the same that you've been doing because you're building them out and you're going to continue those initiatives, but what activities did you actually do around those initiatives over the last year? And we're going to allow you to just provide documentation of the activities that you've done around that particular initiative. So it takes it kind of one more step forward. Last year you said, here's what I'm doing. Here's the initiative I'm going to put in place. This year it's like, is it the same initiative? Have we done a different one? Have we added others? And what activities did we actually do throughout the year? I'm going to pause there. Any questions around the initiative section of the equity measure? Does that make sense, folks? Anything else I can do to clarify? Great. Now under accessibility, there's two pieces to this 2-point aspect of the measure. So first is providing a narrative. So there's a difference between, documentation or evidence or a narrative. Narrative gives you a chance to just kind of describe it in writing. Provide a narrative describing how your home ensures that communications with residents about their medical care in languages other than English are meeting non-English language proficiency requirements. And this can include methods and services such as electronic translation services, language lines, iPads, certified interpreters, and language proficiency assessments of staff who are communicating with patients regarding their medical care. So we want you just to talk through that with us and describe how your home is approaching that. And then at 13.2.2, we do want another narrative, but it's actually more around a plan for ensuring appropriate auxiliary aids and/or services are provided to individuals with a record of or regarded as living with a communications disability. We do want you to address each of the categories below. Now, I will say before I head into these that, as you see in the thing, the home's plan for ensuring those appropriate auxiliary aids. So your home may not have a resident in every one of these categories, but your home does need to have a plan in place to ensure those aids and services will be provided to individuals with any of these particular communications disabilities in the event that you do have a resident that has it. So we don't want you to be reactive, trying to develop plans after a resident enters with one of these communication disabilities. So we want you to address those that are deaf or hard of hearing. We want you to address those individuals living with speech deficits. Address your plan for auxiliary aids and services for individuals living with vision impairments. And address your plans in place for auxiliary aids and services for individuals living with manual impairments. What we then want you to also include is a specific example of how that plan was actually implemented or put into place for a resident, for just one of your residents. You don't need any PHI or any names or anything necessarily there. And it doesn't have to be one example from every one of those bullets. It just needs to be one example from any of those bullets. And I think that within most of your homes, you're going to have at least one resident that either has a loss of hearing, a speech deficit, or a vision impairment. May or may not have folks with manual impairments, quite a few of those. But again, you're not required to give an example of a resident from each category, just an example of how you implemented the plan, how you executed the plan for one of your residents within one of the categories. Does that make sense, folks? Any questions there? Great, and that's all the updates around the equity measure. Limited updates because we've made some adjustments over the last few years. So we're kind of keeping the application pretty consistent, but we're updating where we can and what makes sense for us. So where have we clarified language, made other updates to measures? The biggest one each year we actually make this update. And I'm not going to go through all of this in detail. You'll have it. We'll send these slides out and you'll see it in the recording. But every year we do have to update the percentile scores for the QMs because they are, relevant to the latest available data. So that's just a standard update we make every single year, but those have been updated. You will see that reflected in the application as well, that the 25th, 30th, 40th, and 50th percentile ranges that you need to be in to earn the amount of points available is available. It's in the application. You'll see it here in these slides as well. And then just a reminder that each of the QMs are now worth a total of 4 points apiece. Another yearly update that we do make within the application is around the Medicaid occupancy average. And so the updated new statewide average for Medicaid occupancy is 64.73%. Our program is that who has a Medicaid occupancy 10% or more above the statewide average. Now it's not 10 percentage points, it's 10%. So what's 10% of 64.73? It's about almost 7%, roughly 6.5% there. So you'll see that for the 10%, it's at 71.2%. And for those 5% over the statewide average, between 5 and 10%, so between 67.97 and 71.2, we'll get you 3 points. So just standard update we make every year around the Medicaid occupancy average. I do want to call out around the behavioral health care measure. So this is a measure under minimum requirements at 24.1 that homes must submit the name and contact information of an individual, a person, at the regional accountable entity responsible to be the liaison between the nursing home and the regional accountable entity for behavioral health services. So a 1-800 customer service line, a referral number will not suffice for this measure. And we've heard from folks before that, oh, I contacted my RAE and they told me this is the number I need to call. Okay, well, who told you that? Who is that person? And did you have a conversation? Because what we're trying to get to here, without having to make this overly burdensome within the measure, is we really want to be incentivizing homes to build a relationship with your regional accountable entity, to understand what are the services that are covered and where can they help supplement the behavioral health needs and by providing behavioral health services. Your regional accountable entity serves as the behavioral health organization for every Medicaid member. They're paid a per member per month to provide behavioral health care and services to Medicaid members, including those residents in your home. And we hear often, there's not a good connection there because on the physical health side, you've got it, right? You've got care plans, you're coordinating care. You don't need someone else to coordinate care for your residents. But where we've had a drop off is that relationship has not been established to make sure that you're getting support around the behavioral health needs of your residents. And we also hear that nursing homes are struggling to do this on their own and they don't have enough resources. Well, we have resources. We're paying for them at the state, but we need to have those relationships built. And so we're putting a pretty low bar here for you folks, but we need you to make the effort or we're going to have to consider different incentives here to be able to get folks to move. So just Googling the name of the RAE and getting a 1-800 number will not suffice. We need you to build relationships, have a contact name and from an individual there. That way, we want you to have the conversation. What is it you provide? What is it that you can do to help supplement the behavioral health, the services you provide to help meet the behavioral health needs of my residents? We need you to be able to build those relationships and be able to use those resources. Does that make sense, folks? Any questions there? And if you're having any troubles getting to that, reach out to us here at the department, reach out to me and Richard and say, I'm trying, I just can't get a contact. We'll help you get a contact there and be able to help you make a connection so that you can have those meaningful conversations. Richard, anything you would add there?
No, I think you covered it. We're just kind of reiterating because it's been a sticking point for a while. I think there is some confusion if you're doing the application at the last minute. We're noticing who's Googling it, who's not. We do know facilities within each region are finding people, so we know that there is a method to get that done.
Yeah, I mean, because our next step would be, what services do you understand are available for your residents, right? And so we're staying short of going there to make sure that you built that to give you time to keep building those relationships. So let's know how we can help. Where do we have new tools or resources within the application? So under Measure 19, the antibiotic stewardship, infection prevention and control, we did notice this kind of a little bit last year because it kind of came in right in the middle of our performance year, but the CDC did publish an updated version of the infection prevention and control assessment tool and essentially retired the older one that we still ended up using last year. The measure now requires homes to complete and submit all sections pertaining to long-term care facilities in sections 1. And we have 11 here, but really in the application it says modules 1 through 10 of the CDC infection control assessment and response tool. It remains worth 5 points. So it's like, whoa, we had to do 3 sections last year. Now we have to do 10. So let's talk through that a little bit. What CDC has essentially done here is they have added in some new areas of focus, but predominantly what they've done is really broken this out into more digestible, meaningful areas of focus from what they had before, which we see as like kind of refreshing to see here. Because a lot of, if we look at section 1 around facility demographics from the previous tool, there were actually 9 different sections within section 1, or not section 1 was facility demographics, section 2 under infection control, program and infrastructure. There were actually 9 subsections underneath that covered the program and infrastructure, the personnel and resident safety, surveillance and disease reporting, hand hygiene, personal protective equipment, so on and so forth. Well, what they've done now is broken those out into individual modules. Make sure that one, we can see the areas of focus more clearly and be able to focus your work, because also a lot of that was just kind of combined all in there. Same with section 3. This was the direct observation section that you talked about before, and they had different areas they wanted to hear about direct observations. Well, why make that a whole separate section? So what they've done now is broken out all those pieces to have a demographic section still up front, and then break out training, audits, and feedback, hand hygiene. And we also asked you in section 3 about observations around hand hygiene. Let's combine that all in the hand hygiene section. Let's get what we need for the program and infrastructure, as well as your observation. Transmission-based precautions, environmental services, and you see with parentheses here, if it says observations, this is where instead of having another section around direct observations, they've actually built it into the modules where they want to actually see those direct observations. You can see it's in modules 2, 3, 4, 5, 6, 7, 8, and 9. You will see that it looks like there's a larger number of pages within this new infection prevention and control assessment tool here. What we looked at into our review is that by far, the majority of all the new pages are descriptions and guidelines and instructions, which I think are really helpful to make sure you're getting it right. But in terms of the question pieces, we're not seeing really any increased real volume there. So again, you have to complete modules 1 through 10 under this new CDC assessment tool using the current link that's in the application as well as in this training. Make sure you're completing this tool and not a separate one or some other tool. We know we've seen some even COVID tools that have been completed in the past and things like that. So make sure you're using the link here, using this new infection control assessment and response tool. Any questions or comments there from folks? Does that make sense? Great. And I think this was really nice. I really like this slide because it really shows you, well, what is the difference? It was 3 to 10, but oh no, it's actually, I see where things line up. We're still having to provide a lot of the same information. There's a few newer things that are kind of updated, but all in all, I think it's just a better organized tool now, quite frankly. So what is different then? So demographics under long-term care, the major difference from the 2023 tool is it now also includes questions about the infection prevention and control infrastructure, which used to be in section 2 in the old tool. So it's again, putting things in better places instead of splitting them up, putting them under their categories. Under hand hygiene, the new tool is asking more detailed questions about process instead of employees trained. It's more around processes. Under module 3, the section is a combination of healthcare personnel and resident safety for your transmission-based precautions, respiratory hygiene, cough etiquette, PPE, and the surveillance and disease reporting sections in the old tool. So it basically had 2 different pieces in the old tool, which were personnel and resident safety, combines those. Under environmental services, the new tool includes more detailed questions about responsibilities and processes rather than only asking if policies are in place. High-level disinfection and sterilization is a new topic that was not included in the old tool, so this is something that's a new piece. Under injection safety, the new tool walks through audit questions, whereas the old tool only addresses if audits were routinely conducted. So they've been asking you for a few years now. Do you routinely conduct audits? You're like, yep. So now it's like, okay, well, what questions do you actually ask when you do that audit? Point of care in the old tool, this was included in the audit section. And then the observations are a little more detailed in this new tool, so make sure you pay attention to that. Under wound care, the old tool had an observation section for wound care. Now this new tool includes additional questions about responsibilities and policies. So it's more of that infrastructure and policies as well as observations on wound care. Module 9 is a new topic around healthcare laundry. So those was not included in the old tool. And then module 10, antibiotic stewardship. A little more focus here on education and training about antibiotic stewardship than in the old tool. Kind of some logical progressions you can see, especially after lessons learned through the pandemic. We've also added some resources for you all in the application. The first is we want to be kind of eyes wide open about the cultural and linguistic competency standards that are coming out from Health and Human Services Office of Minority Health. This is something that you're going to see more of coming down from the federal level. So we want to use this program to help get folks ready and prepared. But we're going to provide these as just resources here. As you think about your equity measure, how are you thinking about some of these requirements and some of these other standards that are coming out when you think about the health equity initiatives and things you'll put into your home? And it covers, you know, again, kind of like our statement and governance, leadership, and workforce, communication and language assistance, engagement, continuous improvement, and accountability. And you can see some other things there. So this is a resource that'll be available for you to use as a complement to your program. We're also putting some additional health equity resources in there for you. So the Office of Minority Health has a resource center. So in addition to just the class standards here, they have a whole resource center. They have free accredited e-learning courses around health equity. Please utilize this. Great resource. It's free. Your tax, well, I don't like to say free when things are our tax dollars paying for it, but it's your tax dollars are hard at work. So go utilize it for the benefit of your staff and your residents. We're also excited around the Center of Excellence for Behavioral Health and Nursing Facilities, starting up here within the state of Colorado. Great website here. A lot of things you're going to be hearing coming out of this. You know, I think we heard about it at the last nursing facility advisory stakeholder meeting, and you're going to keep hearing more about this team here operating in Colorado for the next, I think, 3 years or so. And Rich, I'll let you add any more color in here as well. Is they're here, they're funded to provide resources and training and opportunities for you all to around behavioral health. So this will be a nice complement to building your relationship with your behavioral health organization under the regional accountable entities. You also have some other tools and resources here to help support the work that you're doing within your homes as well. We've got some upcoming events you'll see here. The first is actually happening tomorrow from 11 to 12. It's a mental health first aid certification for 3 years. So if you're able to attend tomorrow and your staff's able to attend, they'll leave that training with the mental health first aid certification. Registration is limited to that, so I don't know. We'll have to check with them to see if there's any open spots yet, but certainly reach out. You've got the links there on the website. You see that events page. And then they're actually going to do an introduction to the class standards, and that's for your direct care staff. So that'll be happening next week, Tuesday, August 15th, from noon to 12. Just a 30-minute meeting there around that introduction, so you can really understand not only what those standards are, but the kind of the intention and purpose and goals around that from the Office of Health and Human Services. Or department, sorry. An introduction to creating a trauma-informed culture in the post-acute and long-term care facility. Part 4, grounding as an essential strategy to calm an activated nervous system. So this is really, you know, that current trauma that we are addressing with our trauma-informed care measure now in the application. So this is another exciting opportunity here. This is an hour-long training next Thursday, August 17th from noon to 1. Then there's more. Please bookmark this webpage. This team is here on the ground in Colorado, providing resources specifically for long-term care and nursing facilities around behavioral health. Richard, anything else you would add here?
Well, I just would want to stress, they've come up, it's a free resource, it's funded through federal grants. They work with SAMHSA. They have some curriculum on substance abuse disorder as well. I know we've had some questions about how to help with that in the nursing facilities. In our conversations with them, they have reiterated that they're willing to sit down with individual administrators and develop specific plans for those homes, very individualized training plans based on the people that you have. So it's not necessarily just something where you can click and watch a pre-screen training that is available, but they will develop plans and support plans and curriculums for the individual demographics that you have and needs for your specific home. Related to that, if you are a facility that's participating in the supplemental behavioral services add-on, that's another provider fee payment that the funding has doubled for. This is a resource that you'd be able to use to help you build out your behavioral health services, wraparound services for that program. And I think just reading between the lines here, we're pointing out that they've got trainings that relate to trauma-informed care. They've got trainings that relate to behavioral health. They're going to be here for the next few years with free resources. It's potential that familiarizing yourself with that resource may help you with future applications on the pay for performance. No details specifically on that, but you can probably get ahead of the game for future years by starting to get a relationship with the Center of Excellence for Behavioral Health and Nursing Facilities.
Yeah, that's great. Thanks, Richard. And I'll be just a half step more blunt is we're definitely looking particularly at the 2025 application to be able to incorporate some of this into that application. So definitely early often familiarize yourself with this team here with the Center of Excellence for Behavioral Health and Nursing Facilities. Such an important topic for us. We're going to be making sure that we utilize this resource to the best we can for all of you all. The other place that's important that I want to underscore what Richard said there is not only will they come and help you get a plan, but they'll come and do an assessment in your home of the behavioral health needs and the different types of challenges or the different types of needs that are seen within that community and be able to help you develop a plan. Please start working on that this year or as soon as you can while we have this resource in the state. Be able to get that assessment done. That's going to be a really great resource for folks to be able to use. And thanks, Gretchen. I see some things. We will get those slides out, folks, but yeah, I was just going to ask that if the team can go ahead and post these links, especially let's get that Center of Excellence for Behavioral Health's webpage out there as well so folks can bookmark that. I'll give folks just a few minutes to be able to copy and paste that. And Gretchen, can we get just the web page for the Office of the ones that here on the slides? Can we just get those posted in there as well?
Yep, doing that now too.
No, thanks, Crystal. It looks like mental health first aid. It's either filled up or it's too late to register online at this point. We were a day late and $1 short potentially maybe with our training here, but reach out if you have a particular interest there and we can reach out to the center and see if there's any spaces available or see if we can have another way for you to be able to email and potentially be able to get in on that for tomorrow if they have space. So let us know if you're really interested. And it looks like it's full, I believe people are saying, but we can reach out and just see if confirm that for folks if you're interested.
It should be continuing throughout the year anyway. Yeah.
Yep. That's right, Richard. You were just reading my mind there. And if you missed this one and we are full, it'll be coming back around again. And we'll make sure that if you do let us know your interest, we'll be able to communicate that with that team as well, so that they'll certainly be putting another opportunity out for you all. Okay, can we get that at nursinghomebehavioralhealth.org as well?
Yep, that was sent earlier on.
Okay, great, thank you.
And one thing
Great.
to note, that website also has lots of past trainings, like recordings of the trainings on there. So peruse on the website, and there might be really great recordings on there for you as well.
That's great, Gretchen. Thank you for that. Yeah, great. It's a great resource, folks. There's a lot out there, and like Gretchen was saying, even if they have past trainings, the recordings are out there, so you can go out there and be able to review those. So great resource. We're going to be building strong relationships with this team over the next few years, and we're excited to be able to have them here in the state to be able to help provide resources and training and assessments for around behavioral health in our nursing homes. Okay, before I move into key application dates, are there any other questions around minimum requirements, measures within the application that folks have that we can help address today before we move into kind of the key upcoming dates around the next application? Well, seeing none, this is not your only time to ask questions, though. Certainly reach out to us at any time with any questions that you have. Reach out to me directly or Richard. I'll put our emails in here for you. You have program related questions. If you have technical assistance needs around using the user interface, the portal, the data collection tools, accessing prior information we've sent out to you from your online application, certainly reach out to the PCG team here, and y'all can put that Colorado Pay for Performance email in there. That'll make sure folks have that. Thank you, Gretchen. So what are the key dates? So we're having the training today. The portal will go live December 1st, 2023. We will actually do a portal training and application changes training, which again, that's really more heavily focused on here's how you use the portal, here's how you submit your application. But then we just give a reminder of, and remember, here's things that kind of changed from the last application. Make sure you're well aware of that as you're submitting your application. That's going to happen on December 6th from 11 to 1. Again, the portal closes at the deadline. Got a leap year this year, so you'll get to the 29th this year to do that by midnight. And then preliminary review findings will come out in March. Takes us about a couple of weeks to get those preliminary review findings. Remember, this is where we look through and say, did you miss documentation or have something there that we allow you a quick turnaround to get in before we get into our official scoring. Then we get those final scores released by May 1st, and then that opens the appeal process timeline for the month of May, from May 1st to May 31st, for you to ask for review and reconsideration of any scores that you see there. I see a question that came in through the chat here. Any changes to the prerequisites? No, there have been no changes to the prerequisites. Those remain the same from the 2023 application. Any questions, comments around upcoming dates? Okay, well, that concludes the content that we had for you all around the changes to the 2024 application, as well as our updates around increased reimbursement for pay for performance and our key upcoming dates around the 2024 application. With that, I'll make one final last call for any questions or topics of discussion that anyone else has today around the 2024 application. Okay, hearing none, well, we know you're all very busy folks. We don't want to use time that we don't need. Just a reminder, if you have questions later, feel free to reach out. Hopefully you found this training valuable. Hopefully it's kind of gave you some clarity around what is changing, what's new, what are our expectations around those pieces within the application. Be on the lookout This recording will be made available to you. We'll get the slides out to you as well. And then make sure you're using the latest and greatest application from our website, as well as making sure your contacts are up to date so that you have access to the user portal and that we have the correct contacts for your homes, so that we're making sure good communications are getting to the right folks. And with that, we will go ahead and adjourn. Thank you for all that you do to keep folks safe, well, and healthy in your homes. Please do the same for yourselves as well, and we'll talk to you all again real soon. Take care, everyone.